Larry McLaughlin. I've lived the last 27 or 28 years near Atlanta, Georgia, but about a year ago we moved to Fort Collins, Colorado. When I got here, they diagnosed me with my most recent PET scan, which was it's a PSMA. It's a very new type of technology, a PET scan. And they diagnosed it as stage 4 prostate cancer because it had spread to some lymph glands into the bone. I did not have very many symptoms other than frequent urination. So it wasn't like if I hadn't had the PSA blood test done, I'd have never known. 3 years ago, I got a prostate test that said my PSA score was 107. And I hadn't had a health check in 20 years. I'm the guy that never goes to the doctor. I'm never sick. And the only time I spent a night in the hospital was when I was 10. I broke my arm. And they had to keep me because they put me out with ether. And they had to keep me overnight. But I never went to the doctor. I didn't even have a doctor to go to. So my PSA came back at 100. And my urologist immediately was like, panic, panic. They're checking it. They want me to do all this medical, think about having the prostate out and all that kind of stuff. And I was like, no, I'm not doing all that. And so we started doing our own things. I started doing high-dose vitamin C IVs, 100,000 milligrams twice a week. I've done UVBI IVs, which is an ultraviolet blood infusion where the ultraviolet light and along with ozone helps cleanse the blood and get rid of funguses and stuff. So I did a lot, but my number kept going up incrementally. Next time it was 200, then it got up to 300. By the time that my brother-in-law and I both decided that we wanted to come to a clinic, my number was 800. But I didn't really have that bad of symptoms. So it's like not that big a deal. Other than that, I'm healthy as a horse. My blood tests are all fine. Everything else is good. It's just I had prostate cancer and the number's out of control. So when I got prostate cancer, my brother-in-law was sick. She's the researcher in the family, so she researches everything. She had seen Dr. Goodyear on some podcasts. She got me to watch one. I'm not a big researcher, but I watched one really good one, and it impressed me. I liked his logic. I liked the way he thinks. He deals with facts. They do everything's based on your blood tests and your scans, and not just, well, how do you feel today? Well, that's too ambiguous of a question. That's not even an answer. So I really liked his processes, and we compared other clinics. We thought about other clinics around Arizona. We looked at Mexico. We also looked at Europe and Germany. And we decided that, dollar for dollar, we felt like we could get the best value here. And we really didn't think that the other clinics offered anything necessarily better. I used to be to do some of the things that Brio is doing, you had to go out of country. And now you don't have to. They can do it all right here. So when we looked at it and we realized that this was within our capability, my brother-in-law put his finances together and we were both able to do it at the same time. We actually came together as brother-in-laws going through the cancer treatment at the same time. So we rented a place and we've been here, this is my 7th week right now. I'm just about what makes logical sense. I'm not a doctor. I've been asked by people if I am a doctor because I ask so many questions. But it just, what they do, there's virtually, first of all, there's no harm. The worst thing that can happen here is that maybe it just doesn't work for you. And I can't imagine that would ever be the case, because I met some people that had pancreatic cancer that went home with a clean scan. Somebody that had, I just met the other day, a couple that had both his kidneys failed 100%. And Dr. Goodyear got him. He's living now. That was 4 years ago. And he's living fine. No dialysis, no nothing. So it didn't, surgery is a one and done. You do the surgery, you can't undo it. And I did not want to do anything like that. And so this whole holistic approach, combined with the medical part, like even with the IPT, I really believe in the IPT delivery method for chemotherapy. I've had it 5, I'll have it my 6th time this week. I have yet to experience an upset stomach or anything else. This is the IPT, or insulin potentiation therapy room. It's off by itself. There's usually only 1 or 2 people in here at a time. There's somebody with you monitoring you 100% the whole time from start to finish. Well, IPT is insulin potentiation therapy. And in layman's terms, I'm not a doctor. What they do is, because cancer is hungry and it for sugar, they drop your blood sugar. They'll give me some insulin and they monitor you. And they try to get your insulin down around 60, not to where you'd have any really bad side effects or anything. They want you to drop your insulin. And what that does is that wakes up your cancer cells. And because they start starving, because there's no sugar in your system. And so then they inject the chemo with the sweetener in it. And it's basically like a Trojan horse. It tricks the cancer cells into eating up all the chemo because they think it's just sugar. They don't realize it's toxic. And they eat most of it up. And then once they're done with the process, you shut it down by just eating like some fruit or some sugar, something that's sweet. And then that shuts it down. The other thing about IPT is they only use a small amount of chemo. In my case, they're using about a 10% dose of what a normal dose would be. And there's far less side effects. Like, I haven't lost any hair. I'm not feeling any nausea. I'm not feeling any negative side effects from it. He's hooking me up to some hydration first, just to make sure there's nothing. And then she'll check my blood sugar to see where my baseline is. And then that will help determine how much insulin to give me to get the blood sugar to drop to the number we need it to be effective, to be therapeutic is the word. Therapeutic. This is the insulin. This is what's going to drop the blood sugar to activate the cancer cells to get hungry for the chemo when we administer that. As the blood sugar drops, if it gets real low, you'll start to feel lightheaded, but she'll come back and check in here in about 10 or 15 minutes, and they'll monitor until we get to the target, which is in the 60s. And then that's when they administer the chemo. So after 20 minutes, my blood sugar is now at 63. So that's a target. So now she's ready to do the administer the chemo. This is to help prevent any type of neuropathy that might occur because of the chemo getting into the extremities and could cause nerve damage. And this helps to prevent that from happening.
Okay.
I'm feeling normal. The most uncomfortable part about the IPT is the cold mittens on the hands, but it's only very short-lived.
Which ear would you prefer
while they're administering the chemo, and then shortly thereafter, and then after it's given some time to work, then take those off and it's back to normal. But right now I still feel the same. This is so much better than regular chemo. Oh my goodness. The great thing about this is I actually feel 0 side effects. I feel normal. I don't feel lightheaded or sick to my stomach or nausea, anything like that. It's the least harmful way to do this, I think, that you can come up with, and still have the therapeutic effect of curing cancer. I've read stories where doctors say everybody gets cancer. It's just a question of whether or not we know about it or not, because our body suppresses it or conquers it, and we just never see the symptoms. So it's really a two-pronged approach. I'm a wholehearted, full believer in the way they do it here at Brio. I think it's over the top the best way to do it. So when I got here, my score, like I said, the scale for PSA for men, the scale only goes from 0 to 5. And my score was 800. Now, instantly, and I'm not a doctor, that tells me that something is wrong. Because if the scale is only this and my number is that high, something else must be going on that's affecting this number. And Dr. Kim, one of the doctors here with Dr. Goodyear, told me that some of the medicines that he would prescribe would be, maybe not typical, but they are medical. They're not just herbs and vitamins and stuff. It's very medical. But he says your number will plummet. I said, what do you mean? He said, just watch. So 2 weeks after I got here, well, first of all, it was 800. 2 weeks later, it was 200. And then it was 31. And then it was 10. And then it was 3. So just unbelievable results in just a short 6 week span of time. Just amazing. What I would say to somebody that's maybe not familiar with all the different protocols and feels like maybe they're, a day late and a dollar short and it's too late for them, I would say you have to be your own advocate. That means it may be totally against your personality. I've even met some people here at the clinic that are just, tell me what to do. And they're not really, they'll get better. If they follow what's on the procedure, they will get better. But it's so much more effective if you can dig in and understand, why am I sick? What caused this possibly? What can I do to help prevent it from coming back? Surgeons can cut it out and make cancer go away in one day. But it comes back because they didn't fix the problem. And here we're fixing the problem. But I encourage everybody, be your own advocate. Research, find out what other people have done or have not done. And now with the internet, there's literally no excuse. I would say if you started from zero and didn't know anything, if you spent 1 week researching on the internet, you would have all the information you need to make an informed decision about where you want to go, and I bet you'd come here.